One day you look in the mirror and you notice it. On the white of your eye, from the inner corner, something pinkish is growing. It looks like a film or a wing. You rub your eye, it doesn't help. You rinse it, same thing. It doesn't go away. And every time you look in the mirror, it's there. Most people at this point do one of two things. Either they panic and imagine the worst, or they decide it's just a cosmetic issue they can live with and put off seeing a doctor for years. Both approaches are wrong. Pterygium isn't cancer, and it isn't something terrifying. But it isn't just a spot you can ignore either. It's living tissue that grows slowly, and if it reaches the cornea, vision problems will follow that could have been avoided. Today I'll tell you everything honestly. What it is, why it appears, when surgery is needed, and what happens if you don't treat it. Pterygium is an overgrowth of the conjunctiva. The conjunctiva is the thin, transparent membrane that covers the white of the eye. Normally, it's invisible. In pterygium, part of this membrane begins to grow abnormally, forming a triangular growth that slowly creeps from the inner corner of the eye toward the cornea. The word pterygium comes from the Greek for wing, which is exactly what this growth looks like from above. Triangular in shape, with its base at the inner corner of the eye and its tip directed toward the center of the cornea. It doesn't hurt. In most cases, it doesn't itch. It simply grows, slowly, sometimes over years. And that's exactly why people so easily get used to it and stop paying attention. The main culprit is ultraviolet radiation. This is the most well-established risk factor. It's no coincidence that pterygium is significantly more common in people who spend a lot of time outdoors. Farmers, construction workers, fishermen, athletes, people living in hot and sunny regions. Ultraviolet light damages conjunctival cells. They begin to divide abnormally, and over time, this growth forms. It isn't a tumor in the oncological sense. It's a benign overgrowth of tissue. But like a tumor, it grows. Beyond ultraviolet, other factors play a role. Dry air, people living in arid climates develop it more often. Dust and wind, constant mechanical irritation of the conjunctiva speeds up the process. Chronic conjunctivitis, inflamed mucosa is more vulnerable. Genetic predisposition. If parents had pterygium, the risk is higher. An interesting fact, pterygium almost always grows from the inner corner of the eye, less often from the outer, almost never from below or above. This is because the inner corner receives the greatest amount of ultraviolet radiation due to the anatomy of the orbit. In the early stages, pterygium causes almost no discomfort. A person simply sees a pinkish growth in the mirror, and that's it. As it grows, symptoms may appear. A foreign body sensation, as if something got into the eye, but rinsing doesn't help. Eye redness, especially after prolonged time outdoors in dusty conditions or when tired. Dryness and burning. Pterygium disrupts the even distribution of the tear film across the eye surface. Watering, a paradoxical response to dryness and irritation. And finally, reduced vision. This is where things become serious. When a pterygium reaches the cornea and begins to encroach on it, it pulls the cornea with it, literally changing its curvature. This causes astigmatism. Vision becomes blurry, unclear. At first slightly, then increasingly so. And if pterygium reaches the optical zone of the cornea, the center, it begins to physically obscure the visual field. Ophthalmologists classify pterygium by the degree to which it has spread onto the cornea. In the first stage, the growth barely touches the edge of the cornea. Vision is unaffected. At this point, it can be monitored without rushing to surgery. In the second stage, pterygium has already moved onto the cornea, but hasn't yet reached the optical zone. Vision may begin to be affected. This is the point where surgeon and patient begin discussing surgery. In the third stage, pterygium has reached or covered the pupillary zone. Vision is reduced. Surgery is necessary, and the sooner the better, because corneal changes are already present and may remain even after removal. Here is the question patients ask most often. Do I need surgery? The honest answer, not always and not immediately. In the early stages, if pterygium isn't growing actively, isn't causing discomfort, and isn't threatening vision, observation. Regular ophthalmological checkups, monitoring of progression. Surgery is indicated in the following situations. First, pterygium is actively growing and approaching the optical zone of the cornea. Second, it causes significant discomfort, persistent foreign body sensation, redness that interferes with daily life. Third, astigmatism or vision reduction linked to pterygium has already developed. Fourth, the patient is planning laser vision correction. Pterygium must be removed beforehand because it distorts corneal parameters. Fifth, cosmetic discomfort that substantially affects quality of life. Regarding timing, it's better to operate before pterygium has reached the center of the cornea. Removal is simpler and the risk of recurrence and complications is lower. Pterygium won't disappear on its own. It either stops growing at some point, which does happen, or it slowly progresses further. If it reaches the optical zone, vision loss. If it's removed at that stage, vision may partially recover, but scarring, changes in the cornea will remain. This is exactly why waiting only makes sense under regular medical monitoring, not in forgot about it and stopped going mode. Recurrence deserves special mention. This is the main challenge in pterygium surgery. After simple removal, recurrence, the growth reappearing, is fairly common. This is why modern surgical techniques use additional methods to reduce recurrence risk. Conjunctival autotransplantation, transplanting a small flap of the patient's own tissue to the site where pterygium was removed. This significantly lowers the probability of regrowth. If pterygium is at an early stage and surgery isn't yet needed, there are measures that help slow progression. UV protective sunglasses. This is the most important recommendation. Not decorative dark lenses, but glasses with confirmed ultraviolet protection. Especially important on bright days, at the beach, in the mountains, while driving. Artificial tears for dryness and discomfort. They soften irritation of the eye surface and create a more comfortable environment, avoiding dust and wind or protecting the eyes in such conditions. But all of this slows. It doesn't stop. If pterygium has decided to grow, it will grow. Your task is to monitor and not miss the moment. If you notice a pinkish or whitish growth on the white of your eye, go for an examination. Not in a year, not when it gets worse, now. You need to understand the stage, the rate of growth, and whether there is already any effect on the cornea. If pterygium has already been diagnosed, regular checkups every 6 to 12 months. The doctor needs to see the progression. If vision changes appear, blurriness, haziness, a feeling that something is in the way, don't wait for a scheduled appointment. Pterygium isn't a dangerous condition if you know about it and monitor it. What makes it dangerous is the habit of ignoring it. Many people look at this growth in the mirror for years and do nothing until it starts affecting their vision. By that point, corneal changes are already present, and even a successful operation doesn't guarantee full recovery. The rule is simple. You notice it, you see a doctor. You get a clear understanding of the situation, and from there, either monitoring or surgery at the right moment. No panic, no delay. If you've noticed something on your eye resembling what I described, come in for an examination at Ko'z Nuri Clinic. We'll determine the stage of pterygium, assess its effect on the cornea and vision, and give you a clear recommendation. Monitor or operate, and when. No unnecessary pressure. Only facts. Contact details and booking are in the description below.